Hello everyone, my name is Madeleine McCabe and I chose the public issue of alcohol use disorder. Why I chose this issue? I feel that this is an issue that's not discussed enough anywhere, and it's a very common issue that we see with every age group because there's underage drinking as well. I also chose this issue because addiction runs in my family, and I've dealt with it with my mother my whole life. So this issue hits very close to home for me. So a time I had to be an effective communicator was a time when a patient that spoke a different language had a procedure coming up, and I was helping them take her to the procedure. I think I was in my OR rotation. But this patient spoke a different language and couldn't really communicate her feelings, but I could tell she was very anxious, and just that nonverbal communication helped me. I held her hand, and it helped me communicate with her that it was going to be okay, and we need to learn that we have to help the entire population. And nonverbal communication is a huge aspect when it comes to nursing, um, and giving everyone a chance to speak, whether they don't speak the same language or they're an underserved population as well. Another time I had to be an effective communicator was when I had a head and neck patient. She had a mass removed in her throat, and they placed a trach because she was going to lose her airway, and I was with her all day for DEU, and she kept communicating that she had a hard time breathing, and I kept telling the nurse that she keeps saying it's hard to breathe even though she was satting at 100% oxygen. But I learned that communicating the needs of the patient is super important, because we ended up calling the surgeon, and she ended up having scabs over her trach, and she was actually going to lose her airway again because it was just so scabbed over down there. And I can use this with alcohol use disorder, because you need to get those resources that a person may need, and listen to someone if they say they're struggling with like addiction or anything, and communicating to people who can help them. A time when I had to be a change agent was when my mother was in a coma when I was in the middle of the semester. She actually has an issue with addiction, and she mixed alcohol with some pills, and her heart stopped. But what I learned was nothing is going to go as planned, and you can't really predict what's going to happen, because I had just spoken with her that morning and she was totally fine. I didn't know what was, that she had something seriously going on. I can use this with my public issue because addiction is an unpredictable illness. Um, you never know if how a person's going to act, what they're going to say, what they're going to do when it comes to alcohol use disorder. Another time I had to utilize being a change agent was when I was a certified nursing assistant at a hospital here in Omaha, and they were short staffed, and I was the only CNA on the floor, and we had over 30 patients, and it was like a rehabilitation hospital, so these patients needed a lot of cares. But I learned that you have to adjust to things that you may not like. It was very hard, but communicating and adapting to how the nurses were going to work that day with no help, really. I would try to help them as much as possible, but I had to make sure I got around to every patient and just did what I needed to do. Um, I can use that with my public issue because you need to learn not to depend on someone with addiction. Like, I couldn't depend on a coworker to show up. I had to do it. And you just have to adjust to, like, the person who may have addiction, or adjust to the new situation, or adjust to what you're given. A time when I had to be a reflective individual was when I experienced my first code blue in the emergency department. I was in my ICU rotation, and my nurse in Fremont, and my nurse grabbed my hand, and because they called a code blue incoming, and we went down to the ED, and that was the first time I had ever witnessed one or assisted with one. But what I learned was about being a reflective individual is you need to review, like, your feelings and thoughts towards the situation, and what to expect regarding your feelings, thoughts, emotions, when that occurs again, because being a nurse, it's gonna happen again. I'm sure you'll see a code blue being a healthcare worker. And I can use that with my public issue because you need to reflect on your feelings regarding addiction, especially when it's someone close to you. That's something that I was taught at a very young age, and something I've had to do my entire life. Another time I had to be a reflective individual was when I found out I was pregnant in my labor and delivery rotation. This was pretty interesting because, of course, I was in that rotation when I found out that I was pregnant. But what I learned was I had to reflect on my own feelings and not thinking my experience would be the same as the moms I saw or the babies I saw, because not all the time it's a great experience, or not all the time it's a horrible experience. So I really had to reflect on my feelings and my thought processes regarding being pregnant and how I'm going to be in that situation as well. I can use this as a nurse and with my public issue because you can't put your feelings on someone else or take on their feelings, especially someone with addiction, because that leads to a lot of hurt in life. If you take on their feelings or don't reflect on how you're feeling towards that situation regarding the person with addiction. So, being an educated citizen is so important, is because you, as a nurse especially, you need to learn to change to things that may occur. You never know what's going to happen, so you need to change and adapt and adjust to all your surroundings and your job and what you're doing and your patients. It's just such an unpredictable field. You also have to reflect a lot on your own feelings and emotions. You see a lot of heavy things, and I think reflecting on those feelings and emotions and how if you're in that situation again with a similar case for a patient or something, is so important for your own mental health. And then being an effective communicator is also very important, because I feel that all of healthcare is communication. Not all of it, but most of it is communication, communicating with your doctors, hospitalists, PT, OT. You have so many people that a patient has caring for them, that communicating is just so vital when it comes to the healthcare field. And that's something we really learned over the past 4 years. With that, I know how to better address alcohol use disorder because, like I said, you reflect on how you're feeling towards someone who may have addiction, or you can communicate resources better for them, um, and adapt to what they need, or um, things like that, a new situation for them. Um, but yes, thank you.